Squats are not ruining your knees, but the way most people do them might be. Squats are arguably one of the most important exercises that we can work on. So, from doing basic movements as a toddler, such as just picking up a toy from the floor, to getting out of a chair as we get into our older ages, we do squatting and bending movements all the time. Those sit to stands, those are so fundamental in terms of our day to day activities that one of the questions that is very interesting is, are squats bad for your knees or even for your hips? And this is a very valid question, right? Because then a lot of times we'll see injuries when people are performing heavy squats, whether that be with a barbell, with heavy weights, or even with no weights. Some people will even complain of having knee pain after doing a bunch of squats or doing just squats, like getting in and out of a chair in general. They'll have different types of knee pain that they'll experience. So it's very common for people to experience pain with such a basic movement. Now, the main thing that we want to dive into is what is causing the knee pain people experience when performing a squatting type of movement, right? So, one of the things that you definitely have to take in mind when performing a squatting movement. So let's take the example of just performing squats in a gym, right? So because it's such a fundamental movement that we just naturally do as we age, so starting from a young age as a toddler and as we grow up, we're always doing a squatting type of movement that we think because it's so easy a baby can do it that it shouldn't give us knee pain. It should be something that we can easily just automatically do with weights without thinking of our posture, our form, our alignment with our ankle, knee, and hip joints. It should just be like, oh, let me just pick up this weight. Let me stand up, sit down, do these squats. And it's easy, right? Because we've been doing it all of our lives. However, as we get older, that's definitely far from the truth. You have to be cognizant of how you move when you're performing this exercise, especially if you add any type of external load or resistance. Now that puts more stress on different structures, including the knees, if you're doing it improperly. So that's why, for example, I'll have individuals who will, let's say they'll get into their 30s and they didn't exactly have the most active lifestyle, or they weren't consistently in the gym training from their teens to their 20s, but they decided they wanted to, get in shape and start lifting weights because they hear it's important for your bone health, for your muscular skeletal system, just to incorporate strength training such as squats, and especially with weight. And they'll either do barbell squats, they'll do some squats with no weights, or even with some dumbbells. And after a while, whether that be a day, a week, or a couple of weeks of trying to do these squatting movements, they'll say, oh, now my knees are hurting. And it's only because I started doing squats. But as soon as I stopped squatting, after a week or two, my knee pain went away. I can get in and out of the chair. I can perform the movement without any pain. But if I squat with load, if I squat with no weight, it's fine. But as soon as I pick up some kind of weight, some kind of resistance, now I have the knee pain. So squatting must be bad. It must be causing the pain in my knees. However, this is invalid. This is untrue. Most likely, if for example, if I was able to assess and just evaluate, let's look at how they're performing these squatting movements with or without load, more often than not, it's an issue with their positioning, it's an issue with their alignment, their form, how they're doing the squat. So one of the most common things that you'll see, and you'll see a lot in these online fitness videos, where when these individuals who haven't been trained or who haven't performed squats in a very long time, especially like in the gym setting, they try to add weight and they have poor alignment with their hips and their knees. Specifically talking about knocked knee position, where maybe they have like a barbell on their back, they go down for the squat and the knees start to cave in, and on worse scenarios the knees will even like touch, and now that's just improper movement with the squat. So the stress, the load coming from not only your body weight but the external load that you have on the barbell on your back, that's causing a excessive load on the knee joint, even on the hip and foot and ankle joints, they're in a malposition, malalignment that isn't optimal for performing a squat. And now, maybe that first couple reps doesn't feel too bad, but as soon as they start doing more reps, more sets, or even weeks at a time with improper movement, improper form, then those tissues, whether that be at the knee joint, they start screaming at you. They start telling you, hey, there's pain here. You got to stop doing this. And then as soon as they stop, pain goes away, right? And now they associate that stopping of the squat, the main factor that caused their pain. However, it's not the squat that caused it. It was actually how they performed it. They had poor technique, poor form, or positioning, right? And that's easily addressable and fixable by proper cueing, making sure that your knees are in their proper alignment with your hips. Additionally, a lot of times that'll occur because you have strength deficits, right? Essentially, the hip muscles, your hip external, your hip abductor muscles, you might have some weakness in either both or one side of those hips. So working on the specific glute muscles that are responsible for keeping alignment of the knees and the hips, that's going to be essential in reducing and preventing these types of knee injuries that come with squatting, right? So cueing, just visual, like seeing what malalignment that you have and using visual and or auditory cues, just telling you, okay, notice how your knees are starting to cave in as you go down for this squat. Keep those knees out more so in aligned with your toes or with your feet. So you don't want them coming together, right? So some people, they may not be aware that they're even going into that knock knee position. So verbal cueing, just to tell them, hey, this is happening. Try to correct it by doing this instead. And then once they implement that, that's kind of like an immediate or a quicker intervention to help reduce that knee pain just by putting them in the proper position, right? And then on top of that, addressing the root cause of why the knees are going in. Most likely it's a muscle imbalance or muscle strength deficit. So like I said, working on those glute muscles that are responsible for keeping the knees in that neutral position. Those are things that you want to be aware of how you're moving and how to address it properly to make sure that the squat movement is actually pain-free. So what you'll see a lot of times too is maybe the form isn't so obvious. Maybe you're looking at their squat, or even for someone who's not specifically trained to look at the proper spot or squatting mechanics, maybe it looks decent enough to where you're not sure why they're having this knee pain. But maybe if you were to dive in a little bit deeper and assess, okay, you know what? Actually, your left foot may be going into excessive pronation, or your left foot, what that means is your left foot is a little bit too flat-footed. Now, is that an issue with some of the small muscles around the ankle and foot that are not supporting your arch, right? It's going into that flat foot position versus supporting arch. Or is that something up the chain, up the leg? Is that an issue with those glute muscles on that one side that's leading to that knee going in just slightly, which causes the foot to overpronate and flatten out? And over time, even though you can't obviously visually see it, that excessive pronation, even if it's like mild, could be contributing to misalignment of the patella of the kneecap, for example, and that may be putting excessive strain and overload on some of the kneecap structures, right? So the main thing is like, okay, we got to focus on addressing the form and the symmetry in terms of muscles at not just the hip, not just the knee, but also the foot and ankle. Because then with squatting, even though it seems so easy and fundamental, like we talked about earlier in the video, it's a compound movement. You're involving a lot of different joints, a lot of different musculature groups. So from the foot and ankle to the knee joint to the hip joint, you're using a lot of your core and trunk muscles to stay nice and stable and to able to support, whether that be the bar or even like a dumbbell that you may be holding. So even though the movement is fundamental, there's so many moving components. There's a lot of involved factors from the toe all the way up to your spine. So with the squat, yes, it's a basic movement, and it's one that definitely needs to be worked on throughout life because, like I said earlier, as an older adult, we have to get in and out of the chair, in and out of a car, in and out of a low seat. And that takes a lot of energy, and that takes mechanics and technique and sufficient amount of strength. At some point, we do use a little bit more momentum, more upper body to help us with that. But squatting in general doesn't cause the knee pain that most people complain of. Usually it's an issue with muscle imbalances, muscle discrepancies with their length. So maybe having too tight of a hamstring, too tight of a quad or a hip flexor. Could be just the positioning, which is one of the main factors and most common factors that causes the knee pain. They just have poor form, right? So once you address all of those things, that kind of takes away a lot of the diagnosis. So for example, PFPS, runner's knee, a lot of the strains that we get on the muscles or on the tendons that we have around the knee joint, those can be contributed to those deficits, those asymmetries that we talked about. So the squat by itself is not what causes the pain and is not essentially bad for the knees. It's doing all that with those deficits with improper form. So if you're able to work on the things that are weak, those muscles that have those deficits, you work on the form, you're able to perform the movement with good alignment throughout the whole body from the toes to the feet all the way up, then squatting is a definite exercise that everyone should be working on to different extents, whether that be different types of resistance, different types of load, different ranges of motion, using different types of assistance to perform the movement. But overall, squatting is a fundamental movement that we need to work on because it's so important in our daily life, but it's not one that specifically causes knee pain. It's what comes along with it, and the form and how you do the movement is what causes knee pain. Thanks for watching. If you found that video helpful, please subscribe to the channel, and I'll see you in the next video.